The World Health Organization is urging countries to join a vaccine development initiative. One America's Hubbard reports on the potential downsides of the program.
As researchers scramble to produce a viable vaccine against the novel coronavirus, some experts expressed concerns over potential global supply shortages. On Friday, the World Health Organization urged countries around the world to join COVAX, an initiative it leads along with the Coalition for Epidemic Preparedness Innovations and Gavi, the Vaccine Alliance. With 165 countries having already issued non-binding expressions of interest in the scheme, the organization is now canvassing these nations for funding to reach its goal of delivering 2 billion vaccine doses by the end of 2021.
So any country that supports COVAX has a better chance of getting a successful vaccine candidate than going after a single one on their own.
COVAX is essentially a risk-sharing pool, with countries committing resources to the development of COVID-19 treatments and vaccines in exchange for guaranteed access to a share of production once these are ready for deployment. According to its creators, it was born out of concern over the potential for wealthier countries to corner the market following development of a viable vaccine, edging out poorer nations from accessing global supplies.
Our greatest fear is if we continue with a system that allows pharmaceutical companies all the monopoly control over the medical solutions to this pandemic, that we're going to see a situation of a bidding war, essentially, between rich countries that can afford to make bilateral deals with the pharmaceutical companies, suck up all the available supply and even advanced supplies of these vaccines and treatments when they become available, leaving huge inequity in access across the globe.
Last month, several op-eds were published, particularly focused on the potential for the US, the country currently closest to developing a workable vaccine, to do just that. This following outrage from the French government over a letter penned by Paul Hudson, the CEO of pharmaceutical giant Sanofi, where he stated America would have primary rights to the bulk of its first production run, as it has been the #1 financial contributor to development efforts by the company. Several prominent experts disagree with this assessment, with Tom Bollicki, director of the Global Health Program at the Council on Foreign Relations, for instance, saying it's entirely likely all countries will focus on inoculating their own populations first, rather than just the US. And given the COVAX initiative's stated goal of vaccine deployment by the end of 2021, compared to US projections of delivering 300 million doses by January, as well as President Trump's intimation of his intent to share the vaccine worldwide once domestic rollout has been completed, some point out an American-led vaccine may be globally available before any others.
And when we have that vaccine, it will be discharged and taken care of. It'll be a very, very rapid process all over the country. And perhaps we'll be supplying a lot of the vaccine to other parts of the world like we do with ventilators and other things that we all of a sudden have become very good at making.
Moreover, the initiative would require control over global distribution to be handed over to COVAX administrators, and with China not expressing interest in joining, it has been pointed out the program could tie up the US in a disadvantageous commitment, while a rival nation is free to dispose of its own stockpile as it wishes. Hans Hubbard, One America News.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.